So it is 6:30. And so I'm going to start the meeting. This is a meeting of the Topsfield Board of Health. It is July 16th, 2025. It is 6:30 p.m. and we do have a quorum. Announcements. Their cable TV is Topsfield Cable TV is recording the meeting, and I am recording the meeting. Is there anybody else who wishes to record the meeting? Seeing no one, we will proceed to the next announcement, which is this week, as part of the new trash recycling curbside collection program with G Mello, residents who wish to discard their old trash and recycling barrels and bins may drop them at the old highway garage at 10 School Avenue on July 16th, 17th, and 18th. The Sustainability Committee is working with a nonprofit organization that redistributes barrels and bins in usable condition to underprivileged communities. If you miss this event, G Mello will pick up old trash and recycling bins and barrels curbside at your residence on August 6th, 7th, and 8th. We'll proceed to the next item, which is a moment of silence. Thank you. I see two people have joined, Julia and Bill. Thank you, Bill. We started the meeting. We just had two announcements. One was a trash announcement, which is on your printed agenda. And we just had the moment of silence. So the next item on the agenda is appointments, and we do not have any appointments tonight. The next item is meeting minutes, and those are the minutes of June 18th, 2025. I read them and I have them in front of me, and I personally don't have any corrections or additions. Does anyone else have any?
No, it looked good to me.
Thank you. And would anybody like to make a motion?
I'll make a motion to accept the meeting minutes of June 18th, 2025.
Is there a second?
I could second the motion.
Amy, any further discussion on the minutes? Seeing none, all those in favor of accepting the minutes as written for Wednesday, June 18th, 2025.
Sure, a point of order, quick.
Point of order, yes.
I didn't attend the meeting, so I intend to abstain unless that screws up the votes necessary to accept the minutes. So can you give me advice on that right now?
Well, I think, well, I'll call on you last, Bill. How's
Okay.
that?
You don't have to have been there to,
She's gonna call me last name, so that.
okay. I wasn't there either, so I think we're gonna be stuck no
Okay,
matter
all right,
what.
okay.
Okay, all those in favor of accepting the minutes, please, I'll call you by roll call. Ellen?
Aye.
Myself, aye. Amy
Aye.
and Bill?
Okay, aye.
Okay, so that's unanimous for people approving the minutes, so it passes. Okay, thank you. Next is the health director report. I am listed, hopefully John Coulon, let me see, is he waiting to get in? No. John Coulon intends to join us, but until he comes, I'll just give you a brief update. The office has been very busy. Our health director resigned on May 5th, and oops, my computer. Oh, yeah. Go away. Oh, sorry, I was getting, okay. Nothing has stopped, and it's the very busy season of a lot of people submitting things and wanting to get work done. So, and in addition to their routine inspections. So luckily, we've had, John Coulon has helped us by doing lots of inspections and also some plans. He, some of the things, well, the latest, first of all, there's been a lot of trash complaints, that Sue has handled in addition to, Samantha and Debbie upstairs in town hall. Um, it hasn't slowed down. If anything, it might have speeded up.
What's the nature of the complaints, Cheryl?
Um, well, there was confusion about who was to get the barrels, for one thing,
Mhm.
because there were lists of people and the list might have not been correct. So some people got barrels and weren't supposed to and had to return them, and other people didn't get barrels when they were supposed to. And then people were confused about the days of their trash pickup. So they thought they thought it was going to be this week.
Recycling probably.
Recycling, sorry. Yeah, recycling. They thought it was 1 week, but it was going to be the next. People have complaints about the sizes of the barrels always.
Well, the garbage barrel is pretty small.
I'm thinking, can I make my computer louder? Can I do this? Yes, we can do this. Can make it very loud. Allow participants to unmute themselves. Yes. Oof. Okay. Well, this is fun hosting the meeting. um, so I don't expect, Julia, you've been in the office. Have you want to add anything to the trash story?
You're muted, Julia.
Oh, you're muted. I didn't mean to call on you, but if you have anything else that you can,
Oh, no, I'm sure Sue can speak to it more, but I just want to say it sounds like the same complaints that happened in Boxford when Boxford switched and they had different size barrels, and it's all kind of the same run of the mill questions, complaints, that sort of stuff that the
I
town.
actually think they did a good job.
it depends on who I do too, but it
Yeah.
it
I think the
depends.
garbage barrel is small, but smaller, and I could see a family of four being concerned about the size of the garbage barrel. But I remember remarking to somebody at town meeting, maybe Amy, somebody, that, I actually produce more recyclable stuff than non-recyclable stuff, so the bigger recycling barrel's good.
Yeah, I mean, obviously the majority of people feel that way, or we would have had over 2,000 calls because that's how many households there are, and I don't think we've had that many.
I think the publicity was good. I think it's on the website. They mailed around the thing. Did you everybody get that in the mail? The laminated sheet with
Yeah.
pickup days? I thought it was flawless.
Wow. There's, yay. We'll pass that along, or, in case Kevin and people haven't heard anything good lately.
Yeah.
I think if you compost too, that makes a whole lot of difference. But a lot
I
of
don't get
people in
that. I
town.
don't, that's something I just don't understand.
The compost?
Like Greek. If you speak
Yeah,
Greek, I won't understand.
it was like I don't know, not to be religious, but it was kind of like a come to Jesus moment when I started using the compost. We have like literally hardly any trash.
I get it. That's cool. I should figure this out, right?
Yeah,
Oh,
I mean, it's just because compost takes a ton of stuff. It's like all your smelly stuff, so your trash doesn't smell.
But what do you do with it between the time the
You
powers
have
that
a
be
you
take it
have a
away and you
bucket.
have it?
Yeah, you
especially,
have a bucket on your counter that you
yeah.
buy, and then you have a bucket outside that you put the stuff in, and then they pick it up every week. So that's like the smelly bucket on your porch or
And do the critters get into that bucket?
no, it's got a lock on it that's tight, a really tight lock. They try, they scratch at it, they try, but they can't get into it. It makes a huge difference. Like everything heavy, like if you buy a roasted chicken or something like that.
Yeah, I get it. Yeah, no.
Yeah,
Mm.
It's always a
really
pain.
good.
I'm the kitchen guy. I don't cook, but I clean.
Yeah.
You'll
take
like
out.
it. Honestly, I thought it would be smelly in the house and would be like,
Yeah,
do I want this on my counter? It's not at all. It's not like that at all. It's,
okay,
You
because
have
my
to
wife
get,
is big on smelling stuff.
yeah, I wouldn't want a smelly thing on my counter.
Okay,
well, I mean,
all
I
right.
have,
Well,
I have a
thanks.
plastic container on my counter, but there's two kinds of bags, and the bags are sort of, they're recyclable, they're compostable themselves. So you have to use the bags and you have to buy them. One lines the composting receptacle. It looks just like a mini trash can. It's the same format, and it has the same kind of locking lid. So you line it with this green bag, and then on your counter you just find a container, a plastic container I have one with a lid that I just like an ice cream container or whatever that's empty. Put the little size compostable bag in it, put
Mhm.
your scraps in, but then you put the lid on every night, and just open it up, put more scraps. I mean, like watermelon rinds, all that big
Coffee
stuff.
grinds,
Coffee
paper
grind,
towels.
paper
Yep,
towels.
yep, yep. And it doesn't smell up your kitchen.
Well, I have one that has a filter, a charcoal filter I got
No
from
kidding.
Amazon. So
Wow. Where do you get all this stuff?
that Amazon. Yeah.
At Amazon. Okay.
Yeah. And you can get, color coordinate your kitchen.
Not me. I have an old Richardson's ice cream container.
You're old school, Cheryl. I got a nice stainless steel one with a
Some people have
School's old
a lot
school.
of class.
Okay.
Yeah. Well, actually, now it's an old Tupperware container, but yeah.
there you go. It really does change your amount of trash though.
Did you know that the Tupperware king of the North Shore
Yeah.
lives in Topsfield?
Yes,
Yep.
I did. I know her because my kids went to
Yeah.
school with her family. Yeah.
Yeah.
Former school,
Nursery
that's
school.
What?
Wow.
I know. So, all right. So that's well, we didn't even, okay. So anyway, there's been a lot of, part of the thing is that I think a lot of people didn't read all the stuff on the town website. It's really all there. And people find it easier somehow to just go to Facebook and ask a random question and listen to what everybody else says. It's so simple. Just go to the website and the link is right there on the front page of anything you want to know. The whole composting thing is there too. So
Well, I know. It was one of those things like calculus
calculus.
that just like made me glaze over and freeze.
I never did calculus, so I understand just the way.
Yeah.
Yeah.
So I mean, it's one of those things that I'm actually thinking about going to community college and learning calculus.
Oof. Look at Amy.
Just take the first part. Don't take the second half.
Okay.
Talk to Bob. He'll teach you calculus. We watch YouTubes on calculus all the time.
Well, Bob's a really smart guy, see?
I don't think for an attorney it's that useful though.
Yeah.
No, it's just that everybody knows calculus but me.
Yeah.
Oh, not true.
Yeah. Yeah.
Even
We're-
those of us who took it
I
forget it.
remember all my fraternity brothers bitching about their calculus class.
This
Yeah.
is just like the old days. This is what our meetings used to be like 20 years ago when Bill was chair.
Lots of interruptions, freewheeling. Yes, Cheryl runs a tighter ship.
But they were lots of fun. So thank you for that. Yeah. And fun. We were all for fun. Okay, so we talked about trash and everything. The latest, it's related to trash. We had a complaint about trash behind a store in the shopping center. And that is a result of other towns, the trash strike in other towns. It's sort of related, but
Huh.
so people who think that they don't have enough trash barrel space are going to go find a dumpster somewhere, and the most visible ones are just going to get overflowing. So then that complaint comes in, and that is a thing that we have to inspect, and so that therefore that's what the health agent does, and that's what John Coulon went out on like twice, I think, today. We have
Which one, by the way, Cheryl?
Republic went, well, Republic, Republic is on strike, right?
Yeah, Republic.
Yeah, no. Which
Oh, which
dumpsters
dumpster?
are
It was the bagel bin. The bagel
bagel?
bin.
Because
Because
among us, well, maybe I shouldn't say out loud. I know of a dumpster that's never full.
Oh, well, no,
Yeah,
no,
don't say it now.
so the problem is some of these businesses have dumpsters that come from the company that's on strike. You see what I'm saying? So
Yes. Yes.
they're renting it from them and then they don't come and pick it up because they're on strike.
Yeah.
That's the problem. I mean, all these things have these ramifications that you never expect. So in addition to us having a new trash program, 14 towns are trash
strike.
on strike. So, oh, great.
And we could have been part of that.
Mhm.
Yeah, you could have, except that
We should sell for like $1,000. People can dump a barrel in one of our dumpsters.
always the entrepreneur. Will that go along with the beaver fur hats that you wanted to do?
It was a beaver derby
Derby. Oh, I was,
where I wanted because the beavers they built these dams and they were threatening the town well field, right? And so and we had, and this is right down the street from me. So we had some person who nobody has figured out who it is, who would spring the town traps, the town have a heart traps to catch the beavers who were building the dams that were threatening the town water supply. And so we had a little revolutionary, right here in Topsfield. So my idea was if we really want to get rid of the beavers, because they were really getting bad, and don't forget those Mother's Day floods of 15 or 20 years ago, one or two of the four people who died in Massachusetts in those floods, two people were in Massachusetts, and it was occasioned by beaver dams, each case.
they were in Topsfield.
Yeah, that's what I meant to say. I'm
Yeah.
sorry, Topsfield. One they didn't find for a long time, wedged under a dam. And so I thought if we really want to get rid of the beavers, let's just get rid of the beavers. And we've got all of these outdoor types because one time when I was a chairman, somebody invited me to a beaver barbecue when they went. Meat tastes terrible, by the way. Uh, so there are all these people who'd be interested in, and I thought, let's just have a beaver derby and say we'll give $150 to the person who catches the most beavers and the $150 to the person who catches the biggest beaver. That made me PNG in a lot of circles.
Wow. This meeting is setting a modern record for getting off topic, but
Sorry, Cheryl, sorry.
it's great.
That's all I need.
It shall live on in history. We'll all refer to it later on in life. All right. So continuing, we've had a lot of, let's see, plans come in to be reviewed. We have taken advantage of the services of Connor, who is the Tri-Town Shared Services Inspector, to do some inspections of septic system installations. John has done some. I have gone out. You learn a lot when you go out. I saw some really complicated ones. Oh, I almost called you, Bill. It was down on Perkins Row. So
Oh, I would have loved to have seen it.
all right. If I go on another
I
one, I'll
admire
call you.
those engineers. They really are smart people.
Yeah, but I learn a lot.
Yeah.
And then so lots of Board of Health reviews of building permits. Those are something nobody thinks about very much, but in order to get a building permit, they have to have a Board of Health sign off on the paperwork. And then we will be starting preparation for the Topsfield Fair. It actually started because there was a public safety meeting where with police and fire and the health, and everybody gets together and talks about what everybody needs to know to start the inspections at the fair. So in spite of having no health director or health agent, Sue has kept the office humming and running like a tight ship. So thank you so much to Sue. Yep.
Absolutely.
But speaking of which, so there are too many plans for one person to handle. So um we've been looking around for somebody else to review plans, and um our good friend, who you may remember, Tom Mineta, who used to be on the Board of Health, has stopped in and he said, I could help you if you want. So we said, that would be wonderful. He has a limited time horizon, maybe a month, where he'd be willing to help us with these plans. Tom is a septic design engineer. He has no jobs in Topsfield, and he doesn't intend to take any in the near future. So there would be no conflict with that. And so uh, before the meeting, I went up and spoke with Kevin earlier today to check in with him. And so he said, that's fine, but it would have to be contingent upon a fully executed contract. And so he suggested uh, that the motion would say something like, authorize the chair to pursue retaining the services of Tom Mineta for the purpose of providing additional septic plan review until further notice, not to exceed $9,000, and pursuant to, I'm sorry, contingent upon obtaining a fully executed contract, which would include a rate of pay, town accountant approval that the money is available, and town administrator approval, and signed by the vendor. So that, I think that includes pretty much everything. The reason for staying under $9,000 is if you go over 10,000, you have to get 3 bids, and we wouldn't anticipate going over 10,000 anyway. So, questions? Yes, Bill.
Okay, so it doesn't have to be $9,000. It has to be $9,999 and comply with the law and give you room to pay somebody some more money. Second, if the and this is among us chickens, if the resolution just says authorizes you to sign the contract, then you still are subject to all of those rules, right? But the resolution doesn't have to say that. By virtue of the resolution saying that, that's just the belt that goes along with the suspenders of the rules.
You mean the motion?
Yeah,
Okay. So I know. Well,
just
so
it's not for purposes of this, but just so everybody understands
mhm.
that that if there's a law, there's a law. That's it. And so no matter what we say, if there's a law, there's a law, that's it. And so all we have to do is say, go do it, Cheryl. And then you're subject to the law. And nobody's going to come after you for violating our resolution.
Yes, I understand.
Yeah.
But so and under our law, it's like comes under our purview to appoint any health agents or administrative assistants that we need to do our job, right, Bill? That's
Yeah.
so.
Yeah. And if there's this, and I'm aware of the $10,000 issue. I think we should pay attention to the $10,000 issue. I guess Kevin foresees somebody making a mistake between $9,000 and $999, but it seems to me if you want to spend another $500 to get another plan approved, we ought to be able to do that.
I hear you. But, I was looking for a similar thing from one of the town accountants, and she also advised me, just to be safe, keep it under $9,000.
Listen, I'm down with that kind of caution.
Yeah.
Don't, I really am, but I'm just trying to
Right.
say to everybody here, just so you know, that's something that we all ought to just know, just to know it,
Yeah, so it doesn't have to be in the motion, in my opinion, but I had to say it anyway tonight, so
Yeah.
that we all know.
Mhm.
Okay. Is there further discussion or questions? So I don't,
Here's my motion,
yes,
that we authorize Cheryl to hire temporary uh, professionals to assist in the approval process for septic systems, subject to the law and subject to no contract having a value over $9,000.
okay. Is there a second?
Second.
Okay, then now is there further discussion to that particular motion?
Is there a time frame on that? Should there be a time frame on it?
If you want, Ellen, that's kind of fine. Um, I could see that in 4 years, people would get their knickers in a twist because of this open-ended thing we did today, and say, well, 4 years ago they did that, and now they're still operating under that, and we're unhappy. So that's the issue. If you want to put a time frame on it, you can.
Just please keep in mind that with John Booley starting, he doesn't have a lot on the septic side, so we may need some assistance even when he's on.
I just said professionals, Sue.
Gosh, yeah, we didn't say it's a particular person. I
Yeah.
guess this motion
I'm trying to keep
originally,
it flexible.
well, it's sort of like we always have that ability. I guess this motion was to particularly seek Tom Mineta for a temporary assistance, because he might only do this on a temporary basis anyway. But the other thing that I don't want to confuse the issue, because I'm going slightly off topic, but under the shared services grant, and not even necessarily under the shared services grant, but if you go on the MHOA, Mass Health Officers Association website, there's a new program that is, it's pretty new, saying they have a supply of people who are called subject matter experts. And there has to be about 20 people. And there's ones for septic design, or there's one for, inspection type things. There's public health nurses, and things like that. Whatever you need, they have these people and they will be paid. And what it says on the website is those subject matter experts can be reimbursed from the shared services grant money. And if you run out of your grant money, don't worry, they'll still be provided to any Board of Health in the Commonwealth. And also it says, even if you're not in a shared service arrangement, we will get you a subject matter expert if you need one. And one of the things in the beginning of what they say it can be for is transitioning a new director into leadership skills or something like that, which is exactly what we need. So but what I don't know is, would that be enough help? I think what Sue said is we're still going to need somebody to actually just review the plans, because they're piling up. Right now we have 11 plans in a pile.
Yeah, I understand. My pushback is my traditional pushback, which is that there's always an effort from the town administrator's office to take control of our authority. And I resist that. And I think we should resist that. I don't think we need his approval to hire Tom. But his proposed language inserted that approval. And I don't think that's what we should subscribe to. That's just me, but I put that before all of you to say that I think that we're fortunate enough to have a terrific chairman and who knows what she's doing and whose judgment is spot on. And why do we need to allow the executive to muck around in that? We don't, and we shouldn't.
I have missed you, Bill. You should really attend more often. So, okay. Yep, I see your point. We how could we pay the person without looking into how to pay them? It would be silly.
Well, we put the resolution in there. I mean, I'm not suggesting that we take the whole town bureaucracy and throw it in to the river. I think that as the trash thing indicated, the whole town bureaucracy works pretty well. I just think that that the executive always tries to gain a veto power over agencies, particularly our agency, because we have more authority than other boards. And we should guard that authority because I actually think that whoever constructed the system did a good job. I think the state does a terrific job. I think that the towns do a terrific job. I think our town in particular does a terrific job. And why mess with it? If it's not broken, don't fix it.
Thank you, Bill. Why I had John Coulon has been waiting to join the meeting, and now he's in. John, I apologize. We were having such an important discussion. Were you listening to it? Oh dear. Yeah. Oh, you see what's happening now? Okay. Every time I get like a message, you all go away and then you come back. So John, welcome. We're in the middle of a motion that Bill made and discussing it. Sue, might you have Bill's motion and the words of it?
I think Ellen's
So,
point's a
yes,
good one, by the way.
Sorry, what, Bill?
I said, I think Ellen's point's a good one.
What was Ellen's point?
Frame.
Time limits.
Time frame.
Huh?
Time frame.
Time frame.
Okay, so the motion read, authorize the chair, Shel Knutson, to hire temporary professional to assist in the approval process for septic system design reviews, subject to the law and no contract having a value of over $9,000.
And we had a second from,
Except that I see John was fiddling around with dumpsters and stuff like that, right?
Yeah,
Yeah, so that resolution, we need to expand that if we're talking about John, right?
we're not talking about John. John is already retained to do all that stuff.
All right, okay, good.
We did
All right, okay.
him last meeting, yeah.
All right, okay.
And then we also appointed someone last meeting and he is now no longer reviewing the plans. We thought we were all set, but now we need another person.
Okay, so why don't somebody do an amendment to my motion on Ellen's thing,
For the time frame.
the time frame, and
What
then
do you
we'll,
think's a reasonable time frame? Sure.
Well,
John starts, John Booley.
calendar year 25. Does that work for everybody?
well, if we're talking about a specific person, which I guess we're not
But
anymore.
we're not. We
Okay.
don't want to, right?
Well, that was what the original.
Yeah,
I know.
Tom is great. Tom is perfect, but we don't want to have this meeting again if Tom decides he doesn't want to do it and we need somebody else.
Or what if he stops doing it, and then you need to hire somebody else.
Well, see, but to your point though, Bill, we always have that ability. What we're just trying to accomplish now, what I really wanted to say was, I was hoping that Tom could be, well, we still could just simply appoint him as an alternate health agent, because they have to be, we have the right to hire them, but we do need to appoint them so that they can be sworn in. That's what I was hoping to have happen tonight.
Oh,
But-
that's it? Just that? Then I would move to appoint Tom Morello as a temporary,
For the purposes of providing additional septic plan review until further notice.
perfect,
Okay. Not to, well, period. Yeah.
perfect.
Okay.
The rest of the
He's
stuff,
not, or would you call him a health agent? I mean, John's the health agent, right?
He is, well, in the law, if you look in the legal manual, anybody who is doing such work, like even when there are auxiliary inspectors down at the fair, they all have to be appointed as an agent of the Board
Okay,
of Health.
okay.
I think John would probably agree with that. Would you?
Yes. Are we still bound by any hiring freeze that had been imposed by the town administrator?
Hmm.
Or it wasn't even hiring freeze, it was freeze on expenditures.
Well, I just spoke with him at 4:30 today, and he approved this. He wanted a lot of other language about what the contract would say. And you missed what Bill was saying is we shouldn't need that language in this motion, because of course, we're going to follow the town procedures. How could we do it without the town procedures of, assuring the money is there and stuff like that?
the usual pushback, John.
Yeah. I thought
Poor
I
guy,
thought
I wasn't doing when I was the chairman.
I thought I was helping to solve an emergent issue at the last meeting, and then Cheryl and I got our wrists slapped, and so here we are again. So
Yeah.
apparently Tom has agreed. Now?
He came in today and he said, I heard you need help and I could help you. That's how
Okay.
this was
Good.
like
A month
gift.
ago, Sue contacted him, right, Sue? And he said no.
Right.
So now, okay,
He
good.
can
I'm
do
glad.
it. He said he can do it for a month. After that, he doesn't know.
Well, they're backing up.
We need the month. We'll take it.
Yep. Yep.
Yeah. All right. So now what does the motion say, Sue?
Oh, gosh.
Okay, so the current motion says, make a motion to appoint Tom Mineta as an alternate health agent for the purposes of providing additional septic plan review assistance until further notice.
You like that? And is
That's my
it,
motion.
that's,
I'd like to make a suggestion.
an amendment.
The plan review.
Wait, hold
as-
on. Can we have a second to the motion first?
Oh, sure.
So
I'll second it.
Ellen seconds that. Okay. And discussion, John.
Now, go ahead, John.
Um, as much as we need plan reviews, and we certainly do, Tom is a septic system designer, very familiar with Title V, obviously, and there are other parts to administering Title V at the local level, with which Tom might be helpful. Now, if you want to narrow his assistance to plan reviews alone, that's okay. I just want to make sure that your votes are as informed as possible.
Thank you. Yeah, it's a good point. I think based on a personal discussion we had with Tom today, that is what he wants to, that's a limit of what he wants to do and
Fine.
at this time?
Sure.
Okay, okay. And you know what, in case we need extra help, Connor, the Tri-Town inspector, is still available. We only have, our new person will be starting July 28th, which is like 2 weeks away. So we should be soon ramping up the speed. Not for plan review, but for inspections anyway. And yeah, and yeah, I think this will suffice for the moment. And then when we meet next month, we'll deal with where we're at, I think. All right. Any other further discussion on the motion? Does anybody need the motion to be read? No.
It's effective right now.
The motion?
As
Oh, what?
it is effective right now as we speak. So he can be hired immediately. That's a question.
Yes, yes.
Yeah, well, he can be appointed.
Appointed, yes.
We tomorrow will pursue what the town needs, and Kevin did say it can be as simple as and the simplest contract you can imagine. He told me the words. It's like 2 sentences, and just it's very simple. And he told Samantha all the steps, and we'll just do it tomorrow. But he wanted to get it in tonight because we only meet once a month.
Right.
Yeah. Okay. Any further discussion? All those in favor of the motion? Bill is aye. Ellen, aye. Amy, aye. Myself, aye. So it passes unanimously. Thank you. Thank you very much. Okay. So continuing the report, the health director report, John, you have been essentially acting as our health director. And I think you heard my very high level bird's eye view, perhaps, but what would you like to tell us as our doing everything person?
The work continues unabated. Certainly, the septic system work, as I alluded to a little earlier, goes far beyond plan reviews, including people walking in up to the window at the office with questions about their own system or about the system they're considering to purchase. So you need somebody who will be able to open a file and walk that person through what the documents in the file mean. And you don't steer them in a direction, but you try to enhance what they already understand about that property and about the process. This is especially important when people are looking to move to Topsfield from a publicly sewered community, and they're only used to flush it and forget it. We had 2 dumpsters overflowing in different places in the past couple of weeks, and it required site visits and discussion with people to try and get it cleared up and moving forward. We have not dealt with foods in this past month. There's been so much septic work to be dealing with, and the septic work has included site inspections where we have several septic system installations going on simultaneously at different points. So as you may recall, we have 4 mandated inspections during an installation. So it's important to coordinate with the installer as to what point they are at and try and squeeze it in. And I'm happy to find that most of the people working in town I'm familiar with, having worked with them during my 13 years in town, and it's good to have a relationship with people already. Um, let's see. Any questions I should ask? I'm glad to see Bill here. Uh, uh, Amy and Ellen, you may not know that Bill and Cheryl were part of the group that was smart enough to hire me in 2006. I had searched high and low for such a group, and it was my good fortune to find that in Topsfield, and I. For the most part, enjoyed it. Any job is going to have some low points, but I still consider it. Well, obviously, I keep coming back, and um, apparently, Sue was listening when I've said to her several times over the past 6 years, "If you call, I'm coming." So Sue calls, and I rejigger my GPS, and we get it done. So I'm looking forward um, to working with John Boulay. On the 29th, I've scheduled time with him, and I'll drive him around and answer some questions. But at that point, he probably will not know enough to know what questions he has to ask. But part of the fun of transitioning into a new position, I'm looking forward to the opportunity to be able to contribute and make a difference, because far too often in municipal service, no matter what discipline you're in, you end up dropped into a position with very little history, and you make it up as you go along, and hopefully don't make many mistakes. So I'll be glad to be available to answer any questions that John will have. Any questions from you folks? Cheryl, how did I do?
You did great.
Okay.
Of course. Thank you, John. And I'm glad to hear that you about the 29th. I was apparently mixed up on a lot of things. So that he's coming on the 28th. Um, I have to be prepping for a medical procedure on the 28th and having the medical procedure on the 29th, which I thought was going to be on the 28th. I was apparently confused, but any, I think he'll be busy on the 28th, just
Oh, sure.
signing things, getting
Sure.
it into his office and things like that. Well, if anybody like Ellen or Amy or Bill, if you wanted to drop in on the 28th, just to welcome John Boulay, for, you know what, that would be nice.
Is Sue going to be there?
Oh yeah,
Good.
but just to welcome as a board member, if I'll try and get over there, but I don't know if I can. And John is going to take him on the famous auto tour of Topsfield, which I did for John, right?
Oh, I'd like to go on that, maybe.
Oh, well, can you have a
Sure.
ride along? Can you have a passenger?
Absolutely. Although I don't know where we will put Bill's legs.
Of course, you've got like a sports car, right?
I've got a Nissan Leaf.
Yeah.
But wait,
Uh,
there's a town car.
Okay, sure. We can make it happen, Bill. Absolutely. Absolutely. If you can
Oh, yeah.
stand my talking
What time? What
nonstop,
time? What time?
I'd say 9.
Okay.
Ooh, it's early.
You write that down.
Early. I'm trying to get John into a Northeast training session in Salem in the afternoon.
So
From
you'd have
Monday.
the Topsfield tour in the morning and then maybe go to Salem in the afternoon.
Yeah,
Okay.
I will be going, but remains to be seen if there's room for one more. I'm going to try and sell it to the guy running it. But regardless of how far we get on the morning of the 29th, I'll come back and do another part. There's lots to see in Topsfield, especially the parts that relate to public health. So yeah, I'm looking forward to it.
That's great. Yeah, okay. I want to come, but I guess I can't.
We'll rent a
Oh, it's
bus.
gonna be okay, Cheryl.
Oh, yeah, I'm fine. It's just routine. Yeah, thank you.
No, it's Bill. It's the confusion that she's going to have treated. She's been saying she's confused.
They're gonna drill holes in your head.
Yeah, yeah. Amy and Ellen, this is the way our Board of Health meetings used to go between 2006 and before, up until when Bill left us. I don't remember when that was, but yeah. Anyway,
People
Look-
keep coming back. You can't get rid of us. Okay. All right. Thank you. Don't go anywhere, John. You want to stay with us? It'll be fun.
oh sure,
The old days.
Sure.
Okay.
So, John, you're going to continuing training now, even though you're retired?
You don't want to say that word in front of my wife, or you'll see the eye
Sorry, I
roll.
get it. I get it.
You know,
Yeah.
friends call and say, "Hey, you available to help out?" And just a short time, just a little bit, maybe a month, maybe two. 5 years later, I'm still there. I figure as long as I can keep making my own hours and be advising, I'm mentoring a new director in Rockport on the clock, and filling in Topsfield. And Nahat, I've been there for 26 years, and that's a stipend position. So I never left completely, but the idea was to retire from full time. And so now I'm 1 or 2 days here, 2 or 3 days there, someplace else. Meanwhile, I'm also on the board of directors of Rest Stop Ranch. And that's in Topsfield, for those of you who don't know. 202 Haverhill, directly across from Linebrook Road. And it's a private property with handicapped accessible gardens. And I'm the captain of the garden crew. And you guys should get over there sometime. So anyway, I figured I'd take the opportunity to put in a plug for Rest Stop Ranch. Returning control of the meeting back to Cheryl.
Thank you, co-captain.
Yeah.
Roger that.
No.
Starship Enterprise
Yeah.
continues. Okay. Okay, so just in time for Julia before she gives up on us entirely. Julia, our
Oh, yeah.
Tri-Town
Poor
Public
Julia.
Health
Sorry,
Nurse.
Julia. Trying to get out of here.
That's okay. It's always entertaining, so I enjoy it. So I have a brief update on a number of things. I wasn't able to attend the June meeting or the May meeting, so I do apologize. I had some family things come up for both those meetings. But just a quick recap on measles. I'm sure everybody's been following this in the news. There's a total of 1,309 confirmed cases so far within 30 jurisdictions in the United States. So Massachusetts currently is not on that list, but we do have some confirmed cases close by in Rhode Island, New York, and Pennsylvania. So we're keeping a close watch on that. The cases for reference, in 2019, there was a total of 1,274 cases of measles in the United States. And to find numbers higher than that, you'd have to go back to 1992 when there was 2,126 cases of measles in the United States. So we're definitely seeing a surge. The majority of those cases, 88% of those cases, are related to the outbreaks. So they're all related. The majority of all these cases are related. The next thing on here is avian influenza. The CDC recently ended the bird flu emergency response. So the risk to the general public still remains low. There's been no human to human transmission. And from what I understand, that's why the CDC ended the emergency response to bird flu. So the reporting will be streamlined now. It will be included on the influenza dashboard. So it's not going to be the same response that it previously was. So we do continue to watch that, especially with the Topsfield Fair in town. We've had to be involved in the fair's response just because they have the poultry exhibit at the fair. So that's why that's always on our radar. And with MAVEN or communicable diseases, I did send a report ahead of time. The MAVEN report highlights all of the cases that come through MAVEN. So I just wanted to clarify that those are confirmed, probable, suspect, and revoked cases that all come through MAVEN. If I were to send a report for just one of those items, like just confirmed cases, it wouldn't give a representative, it wouldn't be representative information of everything that streams through MAVEN. So that's just kind of a snapshot of each quarter of the amount of cases that come through. And certainly if there's ever questions on that, I'm happy to answer them. But it is just a very small piece of what we do with communicable diseases. One other piece that I added to that report this month, you'll see at the bottom, it's called the CART assessment. So the CART assessment was what the state looked at in the phase 1 of the performance standards. And the CART assessment was meant to measure the Board of Health response time to immediate diseases and routine diseases. So our immediate diseases would be things like Salmonella, Vibrio, things like that that require immediate follow-up, or measles cases, things like that that you have 24 hours to accept those cases in MAVEN. Our other more routine diseases, if we have cases of Lyme or influenza, those they expect a 72-hour time frame for you to accept all of those cases. So there are some cities and towns in Massachusetts that maybe don't have a public health nurse or an epidemiologist that check MAVEN, and those cases sometimes can go on for a long time. So the state's goal is to have those cases accepted within 1 day and within 3 days. So they do assign, they track now the days to accept. So you can see down at the bottom that for our immediate and routine diseases, the average response time is 1 day. So that's good. So that's because I'm checking MAVEN every day on a daily basis, and those cases are all being accepted and dealt with depending on what the scope of the case is. I will send out with the notes, I'll send out a report that I have been working on. So there's a new community health data tool on the DPH website, and they basically take information from all different sources. So it's a really great source of information for our all 3 cities, all 3 towns, or for every city and town in Massachusetts. But it looks at census data, it looks at information about the cities and towns. It looks at information about health conditions in the cities and towns, overdose rates, injury rates, all different sorts of data. So I did compile all of that information for the Tri-Town, and it's just interesting to look at all the information in that, because that's what should help shape projects in all 3 of our towns, is that data. So the state's made it really easy to access all of the data in one easy place, and you can pull reports on all different areas. So of note on that is that almost 40% of the people in Tri-Town have diagnosed hypertension. So I did think that was just kind of interesting. That kind of proves why we do these wellness clinics and why we do blood pressure clinics. And there's a significant amount of people in our communities that have hypertension already. But there's tons more information on there. It'd be worth it to have a whole conversation or whole meeting just on the data on those reports. The next update is on the wellness clinics and the Tri-Town, this senior visiting program that I've been doing. So I'm still continuing to provide 9 monthly wellness clinics, primarily aimed at seniors, but anybody can come into these clinics. They're 2-hour clinics around the senior living communities. And to date, from January to June just of this year, I've held 45 clinics servicing 167 people in those locations. So those are at places like Littlebrook, Washington Meadows, 4 Mile Village in Boxford, Orchard Circle in Middleton, Ferncroft Tower in Middleton, all these different, and the councils on aging. So that's been a tremendous way to meet people kind of where they're at in their communities already. And you never know what is going to come into those clinics. So it's always interesting. Sometimes it's something very like minor, and sometimes it's something very complicated and somebody's very sick and I'm calling 911 for them. But for instance, recently I had somebody come in that has hypertension, and I always advise people if they have a monitor, bring it in, we'll double check it. We'll go through like a teaching thing. I had one woman that did bring in her monitor, and the way that she was taught to put on her blood pressure cuff was over, I don't know if people can see, was over the joint. It was over her elbow essentially. So she was not applying the blood pressure cuff correctly because she was not taught properly. So when she was taking it, she was getting incorrect readings. And just something as simple as that, I was able to teach her, where the blood pressure cuff goes, how to sit, when to take it, how to log it, all of those things. It makes a big difference in the long run for these folks for controlling their hypertension. So I just thought that was a good example of kind of the types of things I see. I have continued to do outreach and home visits for what are considered the frail elders in town. So I always tell people I can't see everybody in town, but when we have folks that are designated as frail elders, people that need connections to services, things like that, I do go out and see those folks. And there are some people I see just one time and connect them with something. And some of these other folks that might need some more services, I see I have just a couple people I see on a weekly basis, a couple people I see on a monthly basis, quarterly. So every situation is a little different. But I've been able to collaborate with the Council on Aging directors, with the social workers, and with our fire departments on identifying folks that need these additional services. So I've been happy to do that. And I think that that's a big benefit still for our residents. The other thing is the American Heart Association is rolling out a new program with councils on aging in other public places where they're offering free blood pressure cuffs to the communities. So they have grant funding available for this. We just have to sign an MOU with them to get the equipment. And I've talked to all three of the COAs about this already, and they're all on board with it. And they're basically stations that the American Heart Association will set up and provide all of the materials for so that people can self-monitor their blood pressure. So I have put in the request for that. The PHE grant coordinator is looking at that, and hopefully that will come through soon because I think that would be of benefit, especially looking at those numbers that 40% of residents have hypertension. I know we talked about the Topsfield Fair a little bit. There was a meeting about 2 weeks ago, the kickoff meeting for the fair, and it sounds like everything their same plan is going to be in place. They didn't request any changes. They'd like the same training for the food vendors. They'd like the same triage area set up by the Board of Health. We did have some questions for them about their bird exhibit, about the poultry exhibit, and what they'll be doing there, but then the CDC has ended this bird flu emergency response. So we'll check in with them about that. And I have checked in with the state epidemiologist too, prior to the CDC changing this. So we'll keep in touch with the appropriate people on the bird flu response for the fair. Just a couple other things, the proposed immunization clinic plan for Topsfield. We talked about this last year. We usually talk about it about the same time. We do have a tentative plan in place this year to essentially have the same response that we did last year, using an independent pharmacy to come in to do the bigger clinics, and then still ordering a small amount of vaccines so that we can accommodate our homebound residents and also any folks that walk into the health department that can't attend one of the other clinics that are run at Town Hall. So last year we did one in September, October, and November, and that seemed to work out really well doing the 3 clinics, and it took a lot of the burden off of parking of Town Hall doing the 3 clinics. So there was all good positive feedback on those clinics last year. I don't see any need to change it, but it's still an ongoing discussion. And just to remind folks, VNA Care used to do those clinics, and when they dissolved their wellness division, they stopped offering immunization services. So that's why we had changed our response last year. And then I do have all the totals for vaccines. I'll include that in my notes if anybody wants to look at that. but we were able to administer, it was 50 flu vaccines last year and 20 COVID vaccines through the health department. So I think that it's important to kind of have both levels in place here. And then ticks and mosquitoes, just for an update on that, the Northeast has been seeing the worst summer for tick bites in years. It says that the summer's May and June spikes are the largest for at least the 5 years in the Northeast. So, and the MDPH also announced the first animal case of West Nile virus recently. So it sounds like it was a goat in Worcester County. So you will see some communication from the state about that coming out. And then we have been continuing to offer the universal home visits for new mothers. We're part of that North Shore Mothers Visiting Program. So in June, we started sending out the welcome cards, inviting people to a free one-time visit from the public health nurse, and where we can go over, do a maternal health assessment, go over home safety, safe sleep, maternal mental health, those sorts of things. Have not had any responses back from any of those cards yet. We've sent out 2 rounds in both Boxford and Topsfield. Middleton, their clerk was sending them out on their own, I guess. I've not had anybody actually schedule those visits yet, but I knew that the rates were going to be low for uptick just based on our birth numbers in the towns. So we are still doing what we call safe baby class, which is infant CPR. The next class is going to be this Monday, July 21st at the libraries. I've partnered with the libraries to offer the infant CPR class. And then I also go over safe sleep, maternal mental health, a few other things at these classes. I am still looking for a way to get maybe some grant funding to provide CPR books and to possibly purchase. There are these magnets, these post-birth magnets. The grant apparently won't pay, the state won't pay for these CPR books. They cost about $3 a piece for friends and family books, and it's one of the things the grant will not cover, which seems unusual to me, and to a lot of towns apparently. But we are looking for maybe an alternate way to provide, because it's not even a significant amount of books that we need. It would be nice to be able to give those out. The next item on here is the opioid task force. So there was a report released recently from the Bureau of Substance Abuse Addiction Services, and they did report that there's been approximately a 40% decrease in opioid-related deaths. So it's the sharpest decline since 2013. So that is one bit of good news in all of the public health stuff that's happening, that they are seeing a decrease in the opioid-related deaths. In June, we did have a medication check with the pharmacist at Town Hall. We had a fair amount of people come in for that. We weren't expecting, a huge turnout like our flu clinics, but we did receive 11 brown bags. We called it a brown bag check with the pharmacist. 11 bags of medication were returned, totaling approximately 90 medications for disposal. So there were a lot of folks that had questions about their medications and were able to get a medication review done by the pharmacist. So we're hoping to do that again in October at NASCO when they do the hazardous waste disposal day. And we have purchased, with the opioid funds, we purchased the brown bags for the event. We purchased some Narcan canvas bags to give out. And we purchased these bags, they're called doTERRA bags, where they're a charcoal activated bag. So if some folks can't get in to return their medications and they have something at home, they can put their medications in these bags and it deactivates medications. So any opioid medications or anything that might be potentially hazardous, instead of putting it into your, putting it down your drain and it getting into the septic or into the water supply, we recommend just either disposing of all those medications at Town Hall or at the police department or in these bags. The next opioid meeting date hasn't been determined yet, but it should be coming up in, I would say, the next few weeks. I just don't have an exact date on that.
I have a
And
date, Julia.
you do have a date?
Let me look it up.
Okay.
It's a week from Thursday. The 24th.
The
at 10
24th.
o'clock.
Okay. Okay.
Are those public meetings?
They
Mhm.
are. Yep. Yep. They're public meetings, so anybody can go. And the recreational camps in town. So we have typically 4 recreational camps that run in town. So the Audubon camp is opened in June and has been up and running. The Hood Pond camp that has run in prior years is not running this year because of lack of staffing. The Scouts camp at the Topsfield Fair is open just for this week. And then the sports and art camp at the Lutheran Church is running in August. So we've been working on all of those applications, inspections. Sue and John have been on all of those. We've all worked together to try to accommodate all of these camps and what they need done. In the municipal playground program, we were involved in too, just kind of reviewing the health aspects of the program and answering any questions that people had. It doesn't, it's exempt from the recreational camp licensing requirements, but it did still require input just from the Board of Health on a few different questions that they had. And one of the things I wanted to bring up too is that at one of these camp inspections recently, the Board of Health received a really nice compliment from one of the camp directors. And he was so thankful and appreciative of working with Topsfield Board of Health. He operates in many different towns and said that we make the application process so much easier than other towns, and that he feels comfortable and confident reaching out even if he has a simple question. And I thought that was just a nice testament to Sue in particular, because Sue is always, willing and able to help all of these businesses, whether it's a camp or restaurant or resident. And she definitely has instilled that in me throughout this whole process too. So I thought that was very nice of him. And he said there's a lot of other towns that he works with that he would never feel comfortable reaching out to ask a question to, because he just doesn't have good working relationships with some other cities and towns. And I just thought that was too bad, but it's definitely a testament to how the Topsfield Board of Health runs. And then the PHE update, we are working on the FY26 work plan. I have a meeting this Friday with Middleton, and they have announced that the social worker has been hired and is onboarded, is not reachable yet because they do not have an email address or phone, it sounds like, but has started the process of being onboarded. And that's all the update that I have. I know that was a lot, but a lot of things to cover.
Thank you, Julia. That was so comprehensive as usual. Not a wasted word was said, and everything is important. And in the difference, Bill, you might see a difference between having basically no report from our previous nursing services to what Julia does.
Julia, I think you do exceptional work.
Thank you.
I really do.
Yep.
She is the epitome of a public health nurse, and it has been noticed statewide. So she's getting recognition and also requests to, I think, present things and as examples of how to do things. And you can tell us more about that when you know.
You know what that means, though.
What?
She's going to get hired away.
Don't say. I know.
I don't know about that. The state doesn't have a lot of funding left for things. And I do really enjoy working with these 3 towns. I grew up locally and I have a lot of ties with these 3 towns, and I really enjoy working with all the residents and all the people in town. So I'm certainly,
We are grateful for you for working with us. So
You
thank
do a
you.
great job.
thank you.
Yeah. Unfortunately, we have to move along to public health excellence update. And I just have a couple of things. One is Kevin Haratunian, town administrator, is now the Topsfield representative to the Essex Tri-Town Shared Services Collaborative, which is the official name of it, advisory board. And the second update is that Sue Winslow, the town accountant Amanda Oriema, and Patrick Henry, who is our contact at DPH, Office of Local and Regional Health, for the grant, worked together to reconcile financial records from fiscal years 23 and 24. And as a result, $28,144.40 will be transferred out of the Topsfield grant special revenue account and into the town's general fund. And it was quite a back and forth process so that everybody understand exactly what we were supposed to be doing and exactly what the numbers were. But as a result, a memo was sent from me to to Amanda, town accountant, yesterday, regarding Public Health Excellence Grant, PHE administration allocation. And I think Sue sent out this letter to everybody maybe not today, because it was in addition to the materials that were originally sent out. And so the town of Topsfield has reported the following administrative allocations. FY23 was $8,000 and FY24 was $20,144.40. Based on discussions with our Massachusetts DPH representative, Patrick Henry, the Board of Health has agreed that the amount of $28,144.40 shall be transferred out of the grant special revenue account into the town's general fund to be used and appropriated at a future date. And we CC'd the select board in its entirety, Kevin Hartunian, the town administrator, and also the FinCom in its entirety, because we realized that this is a significant amount of money, and a lot of times it somehow just doesn't get pointed out or even recorded, or it just happens, and it's just more money appears in the town budget, and no one knows how it got there. I'm making a terrible generalization, but we didn't want that to happen, so we wanted them to be aware of it. Where this money came from is because those of you who have dealt with grant funding, there's always sort of an administration fee, or sometimes they call it overhead, where the entity that holds the funds and where the employees reside or where the work is done gets to retain a percentage of the grant for overhead or administrative purposes. And so with this grant in particular, it was 15% per year of the allocation of the money. So when we say the allocation of the money, that in itself was not entirely clear, because the first 2 years of the grant, everything was so new that the numbers seemed to move around, and they weren't clear all the time. And also the 15% allocation wasn't even told to us. So we did, so that is sort of water over the dam, so to speak. The state wanted a really tight reconciliation of the money, because they're anticipating a lot of federal oversight, and they wanted to get ahead of that and make sure that we have our numbers all correct. So that's why we double and triple checked all the numbers for FY23 and 24, and then these are the amounts that the town was able to retain for the administrative portion of the grant. And indeed, I mean, we're providing office space, telephones, personnel, in the person of Sue, who did a lot of work and unfortunately was largely unpaid for that work, paid very, very partially and late. But it involved the accounting department keeping track of things and all of that stuff that is it's infrastructure, and it's invisible. It's just like you're driving on the roads, you never think of what has to go into keeping a road drivable. And so that's my simplistic analogy. But at any rate, I did want this letter to appear in the list of documents for today's meeting. And that, yes, so that's for the grant. Does anybody have any questions on that item, the public health excellence update?
So is that for 1 year?
Sorry,
What time frame does that cover?
the money.
Yeah,
So it was fiscal year 23 and fiscal year 24. In other words, we just finished fiscal year 25. Now, don't forget, after 24, the grant went to Middleton. So Middleton will be the fiscal host, and they will be able to retain the 15% going forward.
and what's it, 15%? What was the total amount?
Right. Do I have those numbers in front of me? So, these are numbers we were looking at. So let me see where it is. That's a good question, though.
Well, I just did a quick calculation, 300,000, which would be, is that a correct or near correct to one of the years?
One of the years. So for FY 23, I think it was more like 220, very roughly. I don't have the numbers in front of me.
Okay,
But that's because,
24, if it was 13, I mean, if it was 300,000, 15% is $45,000.
right. However, okay, Sue, I think, Sue, I hate to call on you for this.
Sorry, Sue.
If you
So-
have any,
Without the numbers right in front of me, we worked very closely with Amanda Oriema, our town accountant. And if you'd like, I can send out to all of you the documents that she gave us that break it all down. These numbers that we got from Amanda are correct.
Okay,
it's money. The money came and went and had to be taken into account.
okay.
And then,
Well, those are the things that I didn't hear when you were talking about the different, the 15%. So 28
yes,
doesn't
it
equal
just doesn't make any,
15%. Yeah,
right. Yeah, if we can send that out retrospectively. I know I had it in my folder. Mhm, not readily available.
okay, it's okay.
It was sort of something that you couldn't possibly do this in a committee meeting or a board meeting. And so it was one of those things that happens, in the office. And so
Mhm.
Sue, Amanda's phenomenal, and she really delved into it to more depth than we could have. So between her and Sue, and then myself asking really basic questions like, what is this again? Um, uh, I was the same way. Like, that's what I started out with. How did we get from, where did that 15% come from?
Yeah,
It was
yeah.
explained to me, but I'm like Bill with calculus. Just put a spreadsheet in front of me and my mind goes numb. So, but I understand it, but I can't explain it.
Okay,
Okay. So any other fun questions?
sorry.
That's okay. No, those were good. But luckily, I mean, it's Middleton's thing now, and then the advisory committee is supposed to be reviewing these budgets.
And can I add one thing? I'm sorry. I was just
Yeah.
opening Amanda's email. We had previously sent back money to the state for FY23 and FY24. With the changes in health directors and changes in the town accountants, we went on the numbers that they used. And when Amanda did a forensic accounting, we owed the state more to return. So that was why this number looks low for return funds, but it's because we already did return funds to the state in FY 23 and 24, and this is just correct.
Okay.
We're glad to be, frankly, rid of this part of it because, wow, it was a lot of work.
Yeah.
So, all right. I think that's good. The last thing, bills paid. So you got all the copies of the bills that I signed. We paid $150 for, in this past month, medical sharps pickup, $50 for Board of Health phones, $230 for dead animal pickups, and we reimbursed, and we paid John Coulon $7,345 for inspections of food vendors, pools, hood pond, camps, septic system installations, and review of plans. And that came out of our line item for consultants, but of note is that all of that $7,675 will be reimbursed to the town from the grant, the Public Health Excellence Grant. And so this is something that it kind of doesn't appear anywhere, but I like to really point it out. It just shows that we're spending our line item, but there's kind of nowhere that says it comes back to us. It just comes back into the budget. But one of the things we have to remember when it comes to be budget time, we need the line item to stay there because it's often better to have the person paid out of Topsfield funds and get reimbursed than it is to try to get the money from the grant. And the other thing is, while we were doing this reconciliation process, we had Patrick Henry on the phone from DPHOLRH, and I said, I have to ask you a question. It's okay if you don't want to answer it or you can't answer it, but what is the horizon timeline for this money still to be available, given the federal budget chaos? And he said, I didn't know this. I sort of knew it, but now he said it. The money that we're still using in the grant, the line item in the state budget, came from ARPA funds, state ARPA funds. That they have funded this grant so far, and he said those are secure because we already have the funds through FY 27. So that's FY 26 just started. There's 2 more years. After that, we'll see. But he said, I can tell you that Sam Wong, who is head of OLRH, that's Office for Local and Regional Health, comes under DPH. Sam and his assistant and others are in meetings every single day with groups, any group that he can think of, such as Blue Cross Blue Shield, or any group that might have money that they can allocate to local public health excellence is being explored. And he said, I mean, they're just leaving no stone unturned. And because this excellence grant is huge for the state of Massachusetts. More than 300 towns are part of shared services, and look at the improvement we've had. I'll just listen to Julia, and you can see the effect that the grant is having. So it's not just what we see here on our end. They're setting up training hubs all over the state, because in the past, to get training was incredibly difficult. When I started 40 years ago, every training that might be available was put on separately and was in a different place. I needed to go to Tewksbury for tuberculosis training. You'd be running to Worcester or Boston, and it was all just random. And here we deal with everything. There was no place where we could get everything. We had to go to the silos that existed in the state in order to get it. So now they've consolidated, and our training hub is in Salem, and that's where John Coulon is going to take new John on the Tuesday, to make sure he knows he can do that. Not to mention they also fund training directly. So some trainings are just nobody pays, you just do it, and the services grant covers it. And the other thing to know, this could be the larger disaster that could happen. To go along with this grant funding, there's a carrot and a stick. So the carrot is the funding. The stick is these public health workforce standards are now state law, and so in the past, each of the 351 local boards of health just did the best they could, and if they weren't doing so good in certain areas, there was really no consequences and nothing. No one said anything. Now, Julia mentioned in the CART assessment, that's a tool. It's called capacity assessment, I think review something or other, but they are measuring our capacity assessment to deliver quality public health services in the 3 towns. No one ever measured that anywhere before, and no one cared about it because there wasn't any funding to do it. Now they're measuring it, and we have to have staff that is trained to a certain level. We have to provide services to a certain level, and if they're not provided, there will be consequences. They're not talking about that very much at the moment, but this is a new world, and if this funding goes away, how is that going to continue to happen? Nobody really wants to go there yet with that anxiety, but I'm just letting you know, sharing my anxiety on it. Oh, that was a big rant. Anybody have any comments or questions? Okay. So anyway, so those were the bills, and then for revenue, we took in $1,966.73. All of that was from septic repair, Title V items, and a well. But except for there was $356.73 from vaccine reimbursement, which we are still getting coming into the town, and that also disappears into the general fund because you may remember we were never permitted to have a revolving account. So, and then another place where we get resources is from the Public Health Emergency Preparedness Coalition. We are Region 3A. There are 14 towns in our FEP, Public Health Emergency Preparedness Coalition. Topsfield is one of the towns, and they're allocated some federal funds. It used to be on the order of very, very roughly $4,000 per town. I don't even know what it is these days. Nevertheless, usually one of the things that they did recently in Region 3A, they created a standard operating procedures for various emergencies that might occur. That was very valuable. So that's sort of an intangible thing. Then there are tangible things that we receive in the way of emergency equipment. And so recently we received 4 Belkin USB power banks, which are things that will power your cell phone and your computer if the power goes out. I mean, these are things that we will need to keep running public health when we have the inevitable power outage. And I just, normally this type of thing is signed by the health agent, the health director. Since we don't have one, I signed it, and they wanted to know we received it. This stuff is we've received tablets, computers, software, all kinds of things that we usually just don't even mention. But they track it. So we have the serial numbers. I had to sign for it. They have the serial numbers. And every year they check on every piece of equipment, just so you know, and say, where is it now? Do you have it? Is it functioning? Did it die? Did you lose it? And they're tracking everything. And this is all the stuff that is so routinely behind the scenes, we usually don't even mention it. But I thought I would. So, any questions on any of that? Okay, so then the last thing on the agenda is correspondence, and we are sad to have received a letter of resignation from our wonderful board member, Mark Rizza, and that was sent out. He wrote to formally resign from his position on the Topsfield Board of Health effective June 30th, as he would be relocating out of town in July. He said, it has been an honor to serve on the board since the onset of the COVID-19 pandemic. Joining during such a pivotal and uncertain time, I witnessed firsthand the strength, dedication, and resilience of our community and fellow board members. I am proud to have contributed to the public health efforts that helped guide Topsfield through one of the most challenging periods in recent history. This decision to step down due to leaving Topsfield comes with mixed emotions, as I have greatly valued the opportunity to serve and collaborate with such a committed team. I am confident that the board, health director, and Sue Winslow will continue to uphold its mission and serve the residents of Topsfield with the same integrity and care. Please let me know how I can assist in ensuring a smooth transition before my departure. Thank you for the opportunity to be part of this important work. Sincerely, Mark Rizza. And we definitely are missing Mark. And Julia said today how much he helped. And I don't know if you want to say a few words about that for the record, Julia, during the pandemic.
Yeah, I was asking what I missed at the last meeting and asking about Mark. And I don't know if anybody realizes quite the extent that Mark played in GCAC and in getting color set up for the vaccine platform. And Mark, anytime we had a question during any of the clinics that we were running, he was available by text. I mean, he wasn't more than a minute responding to us if we had a question about adding a new vaccine lot at the beginning, or what about how do we do this on color, or how do we do that? And he was just such a pivotal person in getting all of that organized, I would say, for GCAC and for Topsfield in particular. And he just did it so quietly and unassumingly, and there was never, I don't know, there was just never, you never felt like you were bothering him if you had a question about something. And it was just really good to work with Mark during that time.
Thank you, Julia. And he will be recognized, I guess, at annual meeting, as they recognize people who have served on boards and left. But it's always just a very simple thank you. So I wanted to make sure this got into the record. Maybe it'll make its way back to Mark. We'll have to send him the minutes to read. So, okay. That is all I have. Does anyone have anything else? Oh, okay. We will entertain a motion to adjourn at 8:08.
I move to adjourn.
Second, Ellen. Any discussion? All those in favor of adjourning? Bill,
Aye.
Ellen,
Aye.
Amy,
Aye.
myself, aye. We're adjourned 8:08.